A few months ago, I had a 70-year-old patient come in for a fairly routine procedure, the kind of thing I do all the time. But when I started working on him, I noticed something unusual about his tissue quality, the elasticity, the blood flow, the way his capillaries responded. It was kind of vascular health I typically see in patients 20 years younger. Everything responding the way it's supposed to. After 20 years of doing this, you develop an eye for these things. And this guy's vascular health was generally remarkable for his age. So after the procedure, I asked him what he was doing differently and what he told me changed about how I think about aging. He laughed at first and said there's no real secret, just boring stuff he's been doing for decades. He walks every morning for about 30 to 40 minutes. He eats mostly whole foods, cooks at home, and limits processed junk. Said he can't remember the last time he had fast food. Quit smoking 30 years ago and barely drinks anymore. He goes to bed the same time and gets 7 to 8 hours of sleep. Twice a week, he lifts weights. Nothing crazy, just enough to maintain his muscle mass. Like I said, boring stuff that you've probably heard 1,000 times. But then he mentioned something that really caught my attention. He said, "Doc, I'm 70 years old and everything really works well, if you know what I mean." Now, I'm a plastic surgeon, not a urologist, but here's what I've learned after 20 years of working on the human body. What you see on the outside is almost always a reflection of what's happening on the inside. When I look at someone's skin, what I'm really looking at is their vascular health, their collagen production, tissue elasticity, healing capacity. All of it depends on blood flow, how well oxygen and the nutrients are getting delivered to the tissues. And when the blood flow is compromised, I can see it immediately. The skin looks dull, healing takes forever, bruising is worse, and the elasticity isn't there. Here's the thing most people don't realize enough. Erectile function runs on the exact same system. An erection is fundamentally a blood flow event. Blood flows in and your tissue responds. When that system is healthy and working well, everything works well. When it's compromised, that's usually when it shows up first. And as a matter of fact, erectile dysfunction is often the earliest warning of broader cardiovascular issues. The blood vessels in the penis are smaller than the ones in the heart, so they tend to slow or show dysfunction before anything else does. That's actually why cardiologists pay close attention when a man in his 40s or 50s reports erectile dysfunction problems, because it's essentially a window into their overall vascular health. My 70-year-old patient had excellent blood flow everywhere, which is exactly why his tissues look so good on the table. So what actually protects your vascular system and keeps blood flowing the way it should? The same boring habits my patient described. When you exercise regularly, your blood vessels produce nitric oxide, which relaxes blood vessel walls and improves blood flow throughout your whole body. People who move consistently have more flexibility, responsive blood vessels, while people who sit all day develop stiffer vessels. They don't dilate the way they should. Your diet matters just as much. When you eat a lot of processed foods, sugars, inflammatory oils, you're driving chronic inflammation that damages the lining of your blood vessels. Over time, this leads to plaque buildup, reduced blood flow everywhere. Whole foods, vegetables, healthy fats do the opposite. They actually protect the endothelium. That's that thin layer inside of your blood vessels, which is the inner lining of your vessels. Sleep is another one, big one, that people underestimate. During deep sleep, your body repairs blood vessel damage and regulates blood pressure. So when you're chronically sleep deprived, your vessels literally stop working as efficiently as they should. Not smoking should be obvious at this point, but it's worth saying. Smoking directly damages blood vessels, accelerates plaque formation while constricting vessels and reducing blood flow everywhere, including where it matters the most. And limiting alcohol makes a real difference too. Alcohol increases inflammation, disrupts your sleep architecture, and over time damages vascular function. The patients I see who drink heavily just age faster across the board. Their tissue quality is worse. My 70-year-old has been doing all of this consistently for decades, and it showed in the ways he probably didn't even realize. Now, here's part of the conversation that actually surprised me. I asked him if he takes anything to support any of this, any supplements, medications, and he mentioned that sometimes when he wants a little extra insurance, he uses a generic Viagra called sildenafil. He's actually said that even at 70 with great health, sometimes you just want reliability, that confidence of knowing it's going to work exactly when you want it to work. And then him and his wife, they sometimes use the thrill pill. The thrill pill is a combination of tadalafil, which is more Cialis, which can work over longer periods, generate more blood flow to the areas when you need it, but then it has oxytocin, which is the bonding hormone, and has P141, which is used for hypoactive sexual mood, when your sexual mood isn't there, which you lose those hormones as you age. He said when they take those, they're like 20 years old again, newlyweds. And honestly, I thought that was one of the smartest approaches I've heard in a long time. He wasn't using the medication as a crutch to compensate for a terrible lifestyle. He was doing everything right. And then when he wanted a little extra support, he has the tools available that actually work. Here's what I want you to take away from this. Your vascular health is one interconnected system that affects everything. Your heart, your brain, your skin, your sexual function, all of it. The lifestyle habits that keep you looking young are the exact habits that keep you functioning young. And there's really no separating them. The patients I see who age the best, who heal the fastest, who maintain their vitality in their 60s, 70s, and beyond, they're doing all the boring stuff consistently for years on end. I also want to be realistic with you. Even if you do everything right, biology is still biology, and aging still happens. Blood flow naturally decreases as you get older. Nitric oxide production declines, and vessels get stiffer over time. That's just the reality. And that's completely okay because we have the tools that actually work. Sildenafil has been around for 25 years now, and it's one of the most studied medications in history. It works by enhancing nitrous oxide signaling, which makes blood vessels and improves blood flow. It's reliable, it's safe for most men, and now the generics are widely available. It's actually affordable. If you're already doing the work on your lifestyle and you want a little extra support, there's absolutely no shame in that. It's actually the smart approach. My 7-year-old patient taught me something important. Aging isn't all about any one thing. It's about protecting the systems that everything works, and then having the right tools available to support those systems when you need them. So doing the boring stuff, move every day, eat real food, sleep enough, don't smoke, keep the alcohol in check, and when you want a little extra help, it's there for you. Thanks for watching, and I'll see you on the next one.